So I'm a consultant in respiratory medicine and a lung cancer specialist. And I also lead a programme here in Manchester called the Cure Project, which is around treating tobacco addiction in the hospital settings. So I have a lot of experience in diagnosing, talking to patients with lung cancer and other respiratory and lung illnesses, and also talking to smokers about their addiction and the treatments for it. Okay, so I think there are a few things there. Firstly, specifically looking at smoking and tobacco addiction. For too long, smoking's been viewed and portrayed, particularly in advertising circles, as a lifestyle choice. And as such, a lifestyle choice can be changed, and that choice comes with your own freedom of choice and willpower. Whereas actually tobacco addiction is a very powerful disease that causes physical changes in the brain and a chemical dependence to nicotine. And that has had a knock-on effect and a stigma for both patients and for healthcare professionals. So for patients who face the stigma of this self-inflicted disease, or a choice to do this habit or lifestyle choice that causes them harm, and healthcare professionals, that our role is to tell someone to stop smoking because it's bad for them. When actually what we need to be doing is changing that language to treating a disease and treating a chronic disease. And just as we would treat asthma or diabetes by knowing the medications that help the best and talking to our patients about it, we need to be doing the exact same thing with smokers. I think the other challenge is that everybody knows smoking is bad and can cause disease, but actually there can sometimes be that, well, it may not happen to me. And then it can almost be too late if that does happen, and the motivation to stop may come after the disease has happened. That for smokers, people know that smoking is bad, but motivation to make a change and to seek help often comes from experiencing illness or something that's personal to you. Actually, what this platform may give us the ability to do is for that person to experience the process of being in a hospital environment with the thought of having symptoms that could be caused by something very serious as a result of the smoking, without actually having that disease, and without actually having to go through that. And that, bringing it to a personal level of them being able to experience that for themselves, that can be a real powerful motivator for behavioural change, for and considering then seeking out treatment and specialist support for this addiction. This is an opportunity for the healthcare system to embrace new technologies, and the NHS and healthcare can be slow to uptake the latest technologies that can have significant benefits for our patients. So this is a huge opportunity for us to explore the potential of the latest technology.